to actually treat the area above the tip, making sure there's no fullness there, and in fact making sure that there's a smooth contour of the entire nasal profile. This is something that we do frequently with surgery. One of my patients that had a small hump or irregular contour, and her tip looks better partially by treating the fullness above the tip and partially by treating the bridge. In other cases, to make the tip look nice, you have to raise the bridge, and the idea is the same, to have a smooth contour that has an attractive nose. We can now do this without surgery, and this is a patient that had a non-surgical rhinoplasty. We treated his curved profile and droopy tip with fillers, and this is the result that he was able to get, and we see him here 5 minutes after having fillers to the bridge and the tip. And on frontal view, you see that his bridge is stronger, it's more narrow, and the tip is more defined. An attractive nose on frontal view should have a smooth contour from the eyebrows leading down to the tip, which should be defined and proportionate. This young lady had a wide bridge and a wide nasal tip, and we can see here right after treating her non-surgically with fillers, and her bridge is improved, the tip is improved. On 3/4 view, we can see that the tip actually looks smaller and more defined, and what she had as an undefined super tip fullness has now been repaired, and her nasal profile is more attractive. One of the major differences between surgical and non-surgical rhinoplasty is the procedure time, with the surgery taking about 4 hours and the fillers taking about 15 minutes. How about recovery? This is a patient of mine that had a surgical rhinoplasty to narrow her bridge and improve the tip. We see her here at 5 days when the bandages are removed, and now at 2 months when we're starting to see some of the results of her rhinoplasty. So I advise most of my patients with surgical rhinoplasty to take a week off of work. This is a patient that had some fullness and flatness of her nasal tip, and we see her here immediately after having fillers placed in her nose with some redness and discoloration, and we see her the next day where most of her discoloration has resolved. So the recovery from non-surgical rhinoplasty is about 10 minutes. We want to improve the contour of the nose, making the nose and therefore the face more attractive. Traditionally, with surgical rhinoplasty, we've altered the contour by altering the anatomy under the skin, reducing the bones, cutting the cartilage, or repositioning it. The difference with non-surgical rhinoplasty is that instead of altering the anatomy, we are actually adding to the anatomy, filling in concavities and contouring with fillers. What are the fillers and how do they work? The fillers that I use for non-surgical rhinoplasty are a gel substance normally found in the skin, and they were FDA approved in 2000.